The first step for an FUE hair transplant is your consultation. During this meeting, you'll meet the surgeon, discuss your hair loss concerns, and review your medical history. The surgeon will then evaluate your hair and determine if you're a suitable candidate for a hair transplant.
Anything that you want to know before we go into the surgery?
Not exactly.
So he will explain the surgery once again to you.
Okay.
So if there is any if you have any side effect with medication and stuff like that, there could be problems. So you have to be sure that you don't have that kind of problem. Yes, as you said yesterday. When we give you medication, please use those medications properly.
Okay.
So after the surgery, there could be folliculitis. There's a possibility. So if that happens, then you can come back to the hospital anytime, right? As far as you're in Korea. But when you leave, then you can just contact us and we'll tell you what to do. That's okay. Do you drink and smoke?
Yes.
For 1 month, please don't do that.
Okay.
So if after like 2 weeks, if there's folliculitis, and if you don't smoke or don't drink, then it could get over.
Okay.
So did it start from some point that your hair loss, or you had this from the beginning? Less hair.
At some point.
Yeah.
Probably these recent years after I worked on work stress, I would say.
Okay. Any high sugar level or diabetes you have? No. Any surgery or admitting in the hospital for some surgery or for some treatments before? No. Any disease tests that you had before? For example, like any viral disease or something like that? No. Are you having any medication now?
No.
Any allergy that you have for medication?
No.
No. He will press the back side.
Okay.
So we'll shave this part that he's touching now,
Okay.
and then we will extract from that part. Okay?
Before the surgery, our nurse will apply numbing cream above your eyebrow for later anesthesia. We'll also collect a blood sample for plasma extraction. The back of your head will be shaved and made ready for the surgery. We'll ensure the area where we'll harvest hair is thoroughly disinfected. To make the procedure painless, we'll inject anesthetics into the back of your head. Additionally, we'll inject a saline solution to expand the area and improve the visibility of hair follicles.
Before we continue, please visit roothairtransplant.com for more information.
The process of extracting hair grafts begins. During this step, the surgeon uses a specialized tool to carefully remove donor grafts from your donor area. In the FUE procedure, grafts are extracted one by one, leaving no noticeable scar in the donor area. Once a graft is taken from the donor area, our nurses take active steps to preserve it for implantation. The graft is cleaned, sorted based on the number of hairs it contains, and placed in an active plasma solution to maximize survival. When a sufficient number of grafts are extracted, the surgeon starts implanting them using the implanter pen DHI method. Our nurses load individual grafts into the implanter pens, passing them to the surgeon one at a time. This method allows us to implant grafts between your existing hair, achieving a high density of implantation.
Okay, so now that you're done with the surgery, how would you describe the process? Like, what was most painful, discomfort, part? Was there any big inconvenience or whatever? How would you feel?
Yeah, I think the most painful part is on the anesthesia and the injection. But after that, it's pretty much quite smooth. You don't really feel anything. Yeah, it's a smooth journey. Just that it's quite long. Yeah.
That's true. That's
fine.
true. But you did really well. Well, thank you for putting your trust in us. And tomorrow you're coming back for your first one day post-op checkup, right?
Yeah.
Okay, so we'll see you tomorrow. Have a good day.